Do you have elderly people at home who are beginning to have memory losses, who sometimes cannot recall the names of their relatives or even their children, who forget where they have kept their things, and who sometimes cannot make their way back home? Sometimes they can't even find their own way within the different rooms of the house. Sometimes they don't know whether it is a morning time or it is the evening time. Which day is it? Which month is it? What time of the day is it? Sometimes the thinking is affected. Sometimes they are unable to do their own daily tasks. So, what is it? Is it simple forgetfulness due to aging, or is it the Alzheimer's disease? This is the question for today, and we will discuss all about it. What is it? How is it caused? What are the risk factors? How can you prevent these risk factors from occurring? And when a person has already developed the disease, then what supportive treatment, what supportive management you can give to them and their family. I'm Dr. Mariam Atiq. So, Alzheimer's is one of the commonest forms of dementia, which accounts for 60 to 70% cases of dementia. And the symptoms I've already mentioned. At present, around 50 million people in the world are suffering with dementia. And every year, the number is rising in millions. Normally, it is a disease of the elderly, more than 65 years of age. And after that, every 5 years, the incidence doubles in those people to get Alzheimer's. Women are more affected than men. Rather, the number is double than that of men, and this can be accounted to the decrease in the estrogen hormones as they age. So, although age being the greatest risk factor for Alzheimer's, but it is not just aging, it is a disease. So, we need to understand it. What causes Alzheimer's? There is an abnormal buildup of protein around the brain cells and inside the brain cells. They are mainly the amyloid protein. They form plaques around the brain cells, and the tau proteins, they form tangles within the brain cells. Along with that, there may be a deficiency of acetylcholine, which is a neurotransmitter which helps the brain cells to communicate with each other. So, does this happen with everyone? No, it does not. And it is a progressive disease. The symptoms will get from bad to worse to worst. And all you can do is to try to make the progress of the disease slower. So, who is at risk? People with high blood pressure, people with diabetes, those who are sleep deprived, those who have less physical activity, who are obese, those who are smoking, those who use alcohol, then those with a hearing loss, those suffering with depression, those with unhealthy lifestyles, unhealthy eating, they are all prone to get this disease. So when you know the risk factors from an early age in your life, you can start working on these things and make lifestyle changes so that you don't fall prey to the disease. So what you can do? You have to visit the doctor for your different problems, and whatever medicines are being advised, you have to take them regularly. So you can keep your blood pressure in control. You can keep your blood sugar in control. Then for the decreased physical activity, of course, you have to start increasing your physical activity level. For every healthy person, 30 to 40 minutes of physical activity, which may be in the form of walking, dancing, cycling, jogging, or different yogas, different kinds of workouts, 5 days a week are enough to keep your mind and body healthy. That accounts for nearly 150 minutes of exercise per week, which can be divided into different sessions. Then obesity. Being overweight is a disease and leads to more diseases. The basal metabolic index, the BMI index, which is supposed to be less than 25 for a person to be healthy. In the obese, this BMI, this rises to more than 30 and 35. So how can you decrease it? By healthy eating. Have a balanced diet with balanced amounts of carbohydrates accounting for 70%, proteins for around 30%, and fats for around 10 to 15% of your diet. Have all the fresh fruits, vegetables, green leafy vegetables, berries, grapes, citrus fruits. They are all very important. All the seasonal fruits are important. Then you need to have your proper healthy proteins, lean meats, fish, poultry, livers, beef livers, everything, so that your vitamin B levels, your C levels, and all your nutrients are well balanced. Then those who are suffering with depression, how can you prevent that? By having real life people around you. These days, the world is getting more and more digitalized, and we are losing interaction with the normal humans. So we need to keep that. We need to have a strong family system in which people communicate, they support each other, help solve each other's problems. Then there has to be a radius of friends around you who are supportive and who can help you around. So, no loneliness. Be around real people. All these risk factors can be prevented in this way so that you don't get the disease at all. But those of us who have already gotten the disease, how they can help themselves more? They can start by learning new activities, learning new skills, maybe learning a new language, learning to play some musical instrument. They should play board games like Scrabble, like Ludo, and like all those games which the kids and the children play. So the elders should start playing it with them. In this way, they can communicate also with them, and they can stimulate their brain also. Then they should start doing different kinds of puzzles, the crosswords, Sudoku, all these can be done. Then there are different memory tests which are available online. So many are available. The very simple ones of 3-word memory test, 5-word memory test, in which 3 words are repeated again and again in front of them, and then they are asked to recall them. These can all stimulate the memory very well. Then the families, they have to be very patient around them. They have to understand that they are being helpless in trying to do their daily tasks. So be polite, be patient, accept their aggression and their irritability, and do not leave them alone. Talk to them, communicate with them, have proper conversations, sit down, do storytelling with them, do different activities, painting, music, and you can pick up their pictures from their old albums or something, and you can recall those memories back. In this way, they will be engaged, they will be working their minds up. So be very supportive of them. And then, of course, the doctor has to play their part, because you will need to take them for a checkup, get their brain scans, MRIs, PET scans, which will confirm that it's not just normal aging, but their brain is shrinking in size. Then the different kinds of proteins, the amyloid and the tau proteins, can be checked in the cerebrospinal fluid. The tau proteins can be seen in the blood also. These will all confirm and make the diagnosis that what is the actual problem, aging or Alzheimer's. Then the treatment has to be given by the doctor accordingly. Main treatment is the supportive therapy, but at times they need to give drugs like acetylcholine esterase inhibitors, which will ensure that enough of acetylcholine, the neurotransmitter, is available in the brain so that the brain cells can communicate nicely. Then there are other drugs also, but all that part has to be done by the doctor. So please understand the elderly around you and be very supportive of them. Don't just take it as normal aging. Get them diagnosed, get them treated, and treat them well. Stay safe, stay healthy, share the information, and we'll meet again with another topic. Thank you.